Good evening and thank you for joining us. Global News has learned Ontario will implement sweeping measures that will put that province into a lockdown for almost a month. And here's why. Today, Ontario reported more than 2,300 new infections and 25 more deaths. It's the sixth consecutive day the province has registered more than 2,000 new cases. The caseload is putting pressure on hospitals. And as Morganne Campbell reports, the Ontario government hopes this circuit breaker will break the chain of transmission.
This holiday rush at the mall may be the last indoor gathering in Ontario for now, and it is as if people in this province expect it.
Put it this way, it's our fault for not follow what they're asking.
Global News has learned Ontario will be completely locked down for 28 days come Christmas Eve. Sources close to the Premier's office say the only exception will be in northern communities, which will be placed under a 14-day lockdown period. The move comes at a time the province grapples with record high new cases of the novel coronavirus.
What we're seeing is all over the world, leaders are now sort of rethinking the Christmas holiday and how we're going to position ourselves for it. They may have reasons for their secrecy, but look, I'm going to say this, the lack of transparency erodes trust.
There will be an impact on schools come the new year. Elementary students will not return to class, but will spend the first week of school in learning from home. High schools will remain closed for the entire lockdown period. Sources tell Global News the Premier calls it a circuit breaker, and it will also require all non-essential businesses to shutter across the province, and restrictions could be placed on outdoor activities such as skiing and skating. Medical experts believe stricter measures are needed to curb the spread of the virus.
Probably fines are what's needed. If the threat of, if reason doesn't work, maybe then enforcement is something.
The reality is, if no one ever left their house again, there would be no transmission. So we know logically that works. The problem is what is going to be the downstream effects of that.
The measures are in line with what the Ontario Hospital Association has been calling for to ensure that hospitals do not face a devastating surge in COVID-19 patients.
We see that rejected by too many people. We will see, in all likelihood, a moment of historic difficulty in the month of January.
Meanwhile, Global News has learned that the Premier and his cabinet were considering asking for the provincial shutdown of all airports and to implement a province-wide curfew. In the end, those ideas were rejected. Morganne Campbell, Global News, Toronto.